everyone, this is Erika with South Georgia Medical Center, and I'm here with our President and Chief Executive Officer, Mr. Ronnie Dean. Mr. Dean, thank you for being out here on this rainy day with us.
Look, we're out here with the team that's doing all the great work for this community, for South Georgia Medical Center. It's a privilege. It is a little rainy. It's not as bad as it might appear right now. It has been worse, but the reason we're here, Erika, is I just wanted everybody to see the effort that's going on to get this community vaccinated. And we got to get out here in the rain to show it. So that's what it's about. The people that are doing the real work are under these tents. And as everyone can see, there are a lot of cars coming through today.
That's right. Tell us a little bit about what we're seeing in the hospital regarding coronavirus.
Well, it's still very busy. The patients are really sick. Just last week, Erika, we reached an all-time high of 90 inpatients. One of our critical care units filled up. And today, I'm pleased to tell the community, today we're down to 62 patients. Now, that moves around rapidly. The emergency room has been very busy. But what I'd like everyone to know is while we've been busy with the COVID-19 patients, we're extremely busy with all the other patients while we're taking care of the COVID-19. So we're managing that very well. We've continued services uninterrupted, and then we've been able to pull off this really neat DriveThru Vaccination Center. Very proud of the team for this.
So obviously there's a lot of cars out here right now. I think we will probably have vaccinated about 4,000 by the end of today.
We are reaching 4,000 rapidly. Some may have received the notice, but if you haven't, wanted to tell you that we are establishing vaccination sites at our Berrien and Lanier County campuses. So 2 other hospitals in our system will be vaccinating. Our cancer center is vaccinating certain patients, those that are naturally most vulnerable. So multiple sites are vaccinating, and then inside the hospital we continue to vaccinate our healthcare workforce. So if you think about that, we may be vaccinating up to 500 a day, 250 to 300. I think 272 came through this drive-through yesterday, and it's raining and we're not slowing down. So 500 a day, and the centers have just worked beautifully, and it's helped the Department of Public Health reach more people, and we're glad to be able to do it. All these resources that South Georgia Medical Center is putting out here is about helping us create a community of immunity.
Absolutely. I know there has also been a lot of chatter about vaccine availability. So what are you hearing on that front?
Well, I think the governor is doing a great job interacting with the federal authorities, Erika, to try to get Georgia's vaccine supply up. As there are more sites, more vaccine is being administered. We're trying to, I think, catch up as a state, and I think we're doing a good job. We are concerned that the vaccine supply could slow down scheduling. We have not stopped scheduling at this time. We are continuing, but should that supply be limited, we would have to do as others have done and stop scheduling. But right now we feel confident you can come have your initial dose and then come back in 21 days if it's the Pfizer vaccine and have your second dose, or 28 days if it's the Moderna. So we're very confident right now, and we're going to monitor it on a day-by-day basis, but we have faith in the governor, and we think that we're going to be able to get the supply we need to keep this going for this region of South Georgia.
Very good news. For anyone interested in how they might schedule an appointment at one of our sites, you can go to sgmc.org, and we have a button right there on the homepage where you can see who is eligible to receive the vaccine, as well as see what appointments are available. They do vary as people may reschedule theirs, so it is important, or we may open more slots if we have the availability. So
that's right.
It's important for everyone just to keep monitoring that if you're interested in receiving your vaccine.
Absolutely. Hey, Erika, I'd just like to shout out to the team while we're here. Number one, this vaccination team, let me tell you who it's comprised of. It's employees that are working from various areas throughout the health system and different campuses. They come together, but it's also volunteers. We have retirees, we have students of nursing and many, many others that are coming out here to help pull this off. The community's rallying around these vaccine sites, and I just want to shout out to everybody for that. I also want to remind everyone that we have a great team of nurses, doctors, volunteers, and others that come together inside this hospital and throughout our 4 hospital campuses to take care of these patients, and they're working really hard. But what I wanted to tell the community was y'all have been great at supporting them, the food, the kind words, the cards, the letters, all of that makes a difference in their lives. It's very difficult work, and but they're up for it. They're built for it. They're SGMC strong. We're real proud of them, proud of the community for supporting them.
It certainly has been great. We have received a lot of positive feedback from people coming through this vaccination site, and we are proud to be able to help these citizens who are willing and ready to get their vaccines receive those.
You know, and Erika, if I seem to be excited, I'm just excited we're at this point in the battle against COVID. It is the next line of defense, and there is no question about it that if we'll get to 70% vaccination throughout the region, throughout Georgia, North Florida, throughout the nation, we'll whip this thing. So y'all come on and help and tell everybody to get vaccinated if you meet the criteria, and then hopefully we'll have them here for you. We're just going to keep doing this until we can't do it anymore, but I believe that we've got this thing. Just got to get folks vaccinated.
That's right. Outside of COVID news, we welcomed a few new physicians this past week or over the last weeks. You want to tell us a little bit about who those are?
You know, there's a lot going on. I mean, this health system is growing to meet the needs of a growing region and community, and the more people call on us, the more we want to do. Dr. David Hardy is here, vascular surgeon. He's relocated from Cleveland, Ohio, at the Cleveland Clinic. Just a super individual. He's not only a great doctor with world-class experience, but he's just a good guy. And I can't wait for y'all to meet him. If you need his services, he's available. Dr. Yerkison has relocated here, and he's a Clemson guy, come in here to South Georgia, and he's just a great guy, general surgeon, and there are others, and we can go on for a while about services that are coming, but it's really a privilege to be able to serve and have these new physicians come join us, Erika.
Well, thank you everyone for tuning in today. If you need any kind of updated information, please continue to check out our website at sgmc.org or our Facebook page. Thank you.
Thank you, everyone.